us for this COVID-19 telephone town hall. If you'd like to ask a question, simply hit *3 on your phone and an operator will come and take your question. If you're listening online, you can type your question into the question box on our website. We are just beginning to dial out to households across Arapahoe County, and we want to give folks a moment to join the call. Hi, my name is Erica, and I'll be your host tonight. This is the 6th town hall that Arapahoe County has hosted since the start of the COVID-19 pandemic. Our goal is to bring you critical information that can help keep you and your family safe, also to answer your questions about the pandemic and resources that are available. This week, Arapahoe County began reopening county facilities to the public. Tonight, we'd like to share some information on what you can expect when you visit a county building, as well as give some instructions on accessing services. We have a 3-day weekend in sight, and we know you have questions about activities that are allowable during the Safer at Home public health order. That's why we have Tri-County Health here to help answer your questions and what may lie ahead for us. As a reminder, or if you're just now joining us, if you want to ask a question, you can press *3 on your phone, or you can send your question through the website. So to get things started, we'd like to welcome 3 of our county commissioners. First, we have Commissioner Nancy Sharp. Nancy, go ahead.
Hi, I'm Commissioner Nancy Sharp, and thanks to you all for joining us tonight as we begin our phased reopening of our county facilities. We want to thank you for your patience and understanding. Although we have a different way of interacting with you, please know that our county remains committed to delivering quality customer service in a safe environment. We wanted this town hall to focus on changes that you'll be experiencing in our facilities. I'd like to now turn this over to Commissioner Jeff Baker.
Thank you, Commissioner Sharp. I'm Jeff Baker, and I represent District 3 in the eastern part of the county. The first thing we'd like everyone to know is that most of our services are by appointment only. So you should visit our website first before coming to any of our buildings to see if there's any way that you can complete your business from home. If you eventually decide that you do need to make an appointment, we'll have some safety protocols in place at our buildings. Commissioner Jackson?
I'm Nancy Jackson, and I want to talk a little bit more about visiting the county. If you have an appointment, you should wear a mask when you are inside our facilities. We've also installed signs, stickers, and other markers that will remind everyone to practice social distancing and show you where you can stand relative to other people. All these changes are meant to keep everyone as safe and healthy as possible while we start returning to our daily operations. And now I'm going to turn it back over to Erica, our moderator.
Thank you all, commissioners. And now we'd like to invite Dr. John Douglas, the Executive Director of Tri-County Health. He's here to give us an update on where we are with the pandemic and what we can expect in the weeks ahead. Welcome, Dr. Douglas. Go ahead.
Thank you very much. Great to be with you, our Arapahoe residents, and our commissioners this evening. I'm pleased to give an overview, both about where we stand with the epidemic as well as what will be, we think, evolving in the weeks and months to come. Let me begin by saying that I think Arapahoe County, like Colorado in general and the metro area, is getting to be in better and better shape. We are doing more testing than we had been doing. I'll talk more about that in just a second. But even as we're doing more testing, we're actually seeing a declining number of cases. That's great. You've heard a lot about, probably over the last 8 weeks, about flattening the curve or bending the curve. We were flat up until, about 10 days ago, and now we really have started to see the curve bend. That observation is supported by the fact that hospitalizations due to COVID, that is people who are sick enough that they need to be put in the hospital for breathing support usually, has also been going down and is really trending in a very positive direction. Those two things tell us that we were very successful, and by we, I don't mean we, Tri-County, I mean we, the people of Arapahoe County, and more broadly Colorado, in doing what Commissioner Jackson just referred to, which is social distancing. And as Commissioner Sharp referred to, we're in a safer at home time frame in terms of public health orders and social distancing. That's been somewhat of an opening sort of situation. We're looking forward to that becoming more and more open in the weeks to come. But I really want to extend my deep appreciation to all the folks in Arapahoe County, whether you're employed by someone else, whether you're a business owner, whether you're retired or whatever, because your fantastic cooperation, really all hands on deck, really made the success we've seen possible. So I want to say a few words about a couple of things. First of all, success is not a definitive success. It's a successful point in the journey. And best estimates are still that we will have to worry about this pandemic as a society until we get a vaccine. And although we're hearing lots of good news about promising results in animals and even human studies, we're probably still talking about a 12 to 18 month or so time frame. So I'm just sort of trying to reality set that while I want all of us to get back to living life more normally, we will have to be considering the sort of adjustments that we'll need to make as we go through the next 12 to 18 months. What do those adjustments mean? Well, number one, I mentioned testing, and the message 4 weeks ago was, gee, we're sorry, we don't have enough tests that if you get sick, you can come in and get checked. That left a lot of people thinking, what's the point? I should just stay at home. And now that we have enough tests, we're really trying to work hard to say the script is different. If you feel sick, cough, fever, shortness of breath, loss of sense of smell turns out to be a sign of COVID, please contact your healthcare provider. Let them know that you have an illness that could be compatible with COVID and request testing. There are a growing number of sites around Arapahoe County where folks who do not have healthcare providers can get tested. And as the governor, who underwent his own test on camera the other day, says, or has told us, and I think this is really the case, we've got enough capacity in Colorado that anybody who is sick with COVID ought to be able to be tested. Secondly, part of living in this new era is social distancing. That's sort of this general rule of thumb of staying 6 feet away from folks unless they're part of your family. That means if you go to a store, if you go to a restaurant, which hopefully is going to be something we'll be able to do soon, if you're in the park, you want to maintain that distance because that's the distance that a respiratory particle can be transmitted. Thirdly, we want everybody to be using in public spaces face coverings, face cloths, masks. They go by different names. They're not the things they use in hospitals, but they can definitely prevent transmission of infection. It's not perfect, but it reduces it substantially enough that we think it can make a major difference. The final thing that's part of the new normal is don't forget about the rest of your health care. Lots of us got used to not going to hospitals during the last 6 weeks. We either thought, I'm not supposed to bother the doctors, or I'm not sure it's safe. Both of those are wrong. Hospitals are safe places to go, and if you've been backed up on getting checkups, getting your diabetes taken care of, your heart or lung disease, please don't hesitate any longer. And if you have kids, we are behind on immunization of kids, and we want to do everything we can to sort of encourage folks to get their children vaccinated. The last thing I'd like to say is, as the moderator already pointed out, we're about to enter Memorial Day. It's a weekend of celebration. It's the kickoff of the summer. I want all of us to be joyful. However, I want all of us to be mindful while we celebrate Memorial Day. And we should be reflective of the men and women who've died in serving in the U.S. military, as well as reflective of those who've been lost in the fight against COVID. And as you're enjoying yourself, let that reflectiveness sort of help you temper your exuberance so you can observe the sort of protective measures that I just listed.
Great. Thank you, Dr. Douglas. And now let's go ahead and go to our questions. And our first question, Dr. Douglas, is for you. This is Beth. Beth, you are live. You can go ahead and ask your question.
Hi. I'm getting a lot of mixed messages as I watch news conferences from our governor and our mayor, and they seem to be so positive, and they say everybody's doing a great job of wearing masks. And I am very observant when I go to a pharmacy or another type of place, and I don't see I mean, I see some, but there was an intern the other day in the pharmacy, and she was not wearing her mask, and I reported it because I thought it was important, and so uh, can they get a little more, forceful to say, wear it. I know you can't make somebody wear it, but I feel so much more comfortable when other people are wearing masks and we're told to wear masks for others.
So Beth, I'm like you. I both as a public health director as well as a citizen, I feel more comfortable when people are wearing masks. I will say that we are trying to change what in some cases was a misimpression, or really, frankly, the science evolved from early March when we said, don't bother, they don't help, to early April, middle of April, we said, wait a minute, time out, they do help a lot. So one of the things we're trying to do is correct those earlier misimpressions. Secondly, we're working really hard with our businesses to be sure that they know their employees, I'm really sorry to hear about the intern you encountered in the pharmacy, need to be wearing masks. That's really critical. And you did exactly the right thing, which is to report her. People get busy. Sometimes they don't know. That ought not to be happening. The third thing I'll say is that Tri-County's got a monitoring team that's going around to some of the larger stores in the community. And we are, at least in those larger stores, observing not perfect compliance among members of the public, but I'd say pretty high, between 75 and 85%. And we are relatively confident that as we do better jobs of educating the public, we won't get that to perfect, but we'll get it better and better. And I think that we are actually, in many ways, given that, as you point out, it is a voluntary act somebody has to undertake, in a surprisingly good place.
Wonderful, thank you. Let's go to our next question. We have Peggy, and Peggy has a question for Melissa Sager. Peggy, go ahead and ask your question live.
Hi, I was wondering if I'm allowed to have a garage sale.
That's a really great question. I'm glad you asked because I have an update from the last town hall, and that is you can have a garage sale. The state recently provided clarity on this issue, and they've guided folks to engage in this activity cautiously, no more than 10 people gathered, maybe having some hand sanitizer there, wearing your mask, asking others to wear theirs, but you can engage in the activity.
Great, thank you so much. And I just want to remind everyone, if you would like to ask a question, you can hit *3 on your phone to talk with one of our operators and get in the queue. Okay, next we have Stacy, and Stacy has a question for the Kelly folks. Stacy, go ahead and ask your question live.
Yes, I work at a cosmetology school with students there. If I feel that I am not safe at work, can I still get unemployment?
Stacy, that's a great question. Unfortunately, there is no guarantee that you will be able to get unemployment if it is COVID related and your workplace has put in place the CDC safety protocols, then likely your claim would most likely be denied. If you could prove that they have not done that, then you could be eligible, but fear itself would not qualify you, is how they're looking at that. So my suggestion would be to also call UI to ask further, but there would be no guarantee.
Got it. Thank you very much. Next, let's go to Councilwoman Kathleen Turley from In Centennial, and she has a question for Melissa Sager. Councilwoman, you are live. You can go ahead and ask your question. Councilwoman, can you hear us?
Yes, can you hear?
Yes, go ahead.
Hello, can you hear me?
Yes, I can hear you. Can you hear us?
Yes.
Go ahead.
Yes.
Go ahead and ask your question.
All right. Well, first of all, thank you, Dr. Douglas, for being on the call. I wonder if you really ever have a life. It seems like you're just always on my telephone, morning, noon, and night. So God bless you. And hello to my fellow Arapahoe County Commissioners for hosting this. My question is on youth sports. Youth sports. Is there any way, instead of a one-size-fits-all in approaching this, if we could single out our young people and let them get outside and on the courts and on the baseball fields? We need to get them outside. And then those of us that are over 70, that's me, you can treat us in a different way. Hello?
This is Melissa from Tri-County. I'd love to take that question. We're getting this a lot about youth sports, and we do understand the importance of getting youth back outside and being physically active. We are having active conversations both with our regional LPHAs in the Denver metro area, as well as with the state, about what it looks like to get our youth playing again, but to do so safely. So as you may know, currently there's a 4-person limit on what's defined as personal training under the Safer at Home order. This allows some very small group physical activity to occur, and we do have some of our youth sport entities operating through 4-person small groups with youth. We are looking at what it looks like to have larger groups and play together. Currently, that still looks like smaller groups. We're looking at different things we can do in different spaces, especially outdoors, and utilizing that vast space we have to the greatest extent possible. There's still issues with contact sports and coming in close contact, because even though kiddos are at less risk of complications from COVID, they can still take that back to families who may be more at risk. And they're also we're also looking at how they can engage in activity while maintaining social distance initially and then phasing in more. There are other issues like spectators, parents hanging out, and so all of these things we're actively talking to both our sports organizations as well as the state about what this can look like moving forward. We do anticipate additional guidance this next week on Monday, and so keep an eye out for that and do check back with us. We're happy to provide additional guidance.
Thank you very much. And let's go to our next question. We have an online question from Sharon, and she would like to know how she could get a new license plate, and that goes to our motor vehicle director, Selena Bashira. Go ahead, Selena.
That a lot of people are asking this question, and we recently have been opening our offices up for appointments. We currently, if you go to arapahoegov.com/DMV, you can make appointments there. Right now, we have appointments available at our Littleton office and at our Centennial office. We're slowly rolling the offices out as we make improvements to the space that will help keep our customers and our staff safe. And right now, I think appointments are booked out about 3 weeks, 2 to 3 weeks, depending on which office you're at, and we'll slowly be opening our other offices as well once those improvements are made.
Wonderful. Thank you for answering that. And our next question is Thomas, and he has a question for Sheriff Tyler Brown. Thomas, go ahead and ask your question live to the sheriff.
Hi, good evening. It's kind of for the doctor and the sheriff, too. First off, I am extremely concerned about the direction we are going and going so fast. And as a part of that, there's got to be more enforcement. I don't care what your people are telling you, but the public, we're out there, and I have to go to the grocery store or Walgreens, and at least I would say in King Soopers, I won't mention which one. I don't want to get them in trouble. Anyhow, yes, they're masked up and all, but the customers, and my God, these younger kids, I'm 64 years old. These younger kids, they just are not wearing masks. And, these gatherings that are happening, I understand the sheriff doesn't have enough manpower. But if there's at least a threat that they can receive a citation, I think that would go a lot further than just instructional method. That's it.
Thomas, this is Sheriff Brown, and I appreciate your question, and I definitely appreciate your concern. I think a lot of citizens across the county and across the state and the nation share that sentiment with you. I think one of the things that we can be the most productive with is education. When we contact people, we try to make sure that we take the appropriate steps to make sure that we're wearing our PPE. And if somebody's not wearing their PPE, we educate them about that, where they can find PPE, how they can make a mask. I think that that's very important. I want people to understand, too, that we've taken a step back on true enforcement of this and really gone to the education side, because we don't want to overwhelm the court system, which was already overwhelmed in the 18th Judicial District. We're the busiest judicial district in the state of Colorado, and that doesn't look to be slowing down at all. We've received some guidance from Chief Justice Coates at the Colorado Supreme Court, as well as Chief Judge Amico in the 18th Judicial District on things that they're hearing right now inside of their courtrooms. So we don't want to overwhelm the courts. We do have the ability to enforce the health orders. There is a statute on the books, and we talk to people about that continuously. We're just trying to make sure that people understand the ways that they can help out their community and use that social peer pressure to make sure people understand that they might not be doing it for themselves, but they're doing it for you, sir, at 64 years old. They're doing it for their aunt who's high risk. They're doing it for their grandparents. So those are the conversations that we're having, but we just don't want to overwhelm the system.
Wonderful. Thank you so much, Sheriff, and thank you, Thomas, for that question about masks. Speaking of masks, that leads us to our next poll question. We are going to ask you what you think. So we'd like to know what you are seeing when you're out and about. Specifically, we'd like to know if you're seeing people wearing masks or face coverings when in public. So you can vote by pressing that number on your telephone keypad. Press 1 if you regularly see more than 75% of people wearing masks in public. Press 2 if you see about 50% of people wearing masks in public. Or press 3 if you see less than half of people wearing masks or face coverings in public. And you can go ahead and vote now, again, on your telephone keypad. All right, thank you very much. Let's go to our next live question. This is going to be for Dr. Douglas. This is Caitlin in Centennial. Caitlin, you can go ahead and ask your question to Dr. Douglas live.
Thank you for taking my question, and good evening, everyone. I'm a parent of 2 students in Littleton Public Schools, and like many parents, I'm growing increasingly concerned that students may not return for full-time in-person learning this fall. I know every family is different, but personally I support returning to full-time in-person learning for our students' academic, social, and mental development. When I voiced these concerns to our superintendent, he said that those decisions are not being made by school boards, but instead that Tri-County and the governor's office, I'm assuming CDPHE, have the sole authority to decide how and when students will return to school this fall. So my question this evening is, what is Tri-County's current thinking about in-person learning? What is the timeline for those decisions to be made? And how will Tri-County engage with Arapahoe County families in those planning conversations? And again, thanks for taking my question.
So that's a really important question, and actually one in which I'm in a total agreement with you. The current situation of the schools is that they're not in session per an order by the governor. We have been working closely with the superintendents really ever since the spring break back in March got extended for the rest of the year, and that includes Littleton Public Schools. I just sent the superintendents a 5-page summary of public health guidance about what parameters we thought could be useful to them in planning the reopening. It's my understanding that the superintendents in each of the districts is developing plans. They have been terrific in consulting us, but we actually don't have orders that would prohibit them from moving forward. And honestly, I really prefer working with them in that sort of consultant role. I am anticipating the governor will be modifying his orders, and I suspect leaving it up to local efforts. I do know the Colorado Department of Education has been working with the Colorado Health Department on guidance. Now, that guidance may include some mandatory parameters. I suspect it probably will include things like 6 feet of social distancing and the use of face cloths as much as possible. Not everybody can tolerate wearing those. So let me just emphasize that I believe getting our kids back to school is incredibly important for educational, mental health, social, nutritional, all kinds of reasons. And we're totally on board with working with schools to helping them figure out ways to do that safely.
Wonderful. Thank you, Doctor. Next, let's go to Judy. And this question is for Melissa Sager with Tri-County Health. Judy, you're live. Go ahead and ask your question.
Hi, my name is Judy. I'm on a board of directors of a homeowners association. We have 2 pools that we're waiting to open, have no direction. Is there any time frame that you guys are going to come out with directions as to how we can open them, when we can open them, and what the criteria guidelines are going to be?
Yes. Outdoor pools are very huge, especially given summer starting. And so this is a question that we're getting a lot. And it's one that we think that we will have additional guidance on Monday from the state. And that's going to look like a timeline as well as followed by guidance on how to open these facilities safely. We are in regular conversations with the state and have and really do anticipate this information coming soon. It does look like a lot of the things that we have been talking about, social distancing, so 6 feet apart. It may look like a schedule where you have to have an appointment to come visit the pool and you come for a certain amount of time so that we can really control how many people are there to ensure that everyone can maintain that distance. And so it's going to look a lot different than it has in the past, but those conversations are happening and we anticipate the guidance soon. So please do check back both with Tri-County as well as the State Health Department for announcements this coming week.
Great, thank you. Next, let's go to Dr. Douglas. The next question is Betty, and she has a question for you. Betty in Aurora, you are live. Go ahead and ask Dr. Douglas your question.
Dr. Douglas, I've been hearing on the underground that there is another variant of the COVID corona that we're dealing with, and this one, instead of affecting the older people, this one is affecting the children. Do we have that here, and is that something that we need to be concerned with?
So this is a really timely question, Betty. Thank you for that. This is a syndrome that was recognized first in the United Kingdom and then in New York City about 3 to 4 weeks ago. There have been 3 cases of this syndrome, which is called the multi-system inflammatory syndrome, or MIS, kind of a weird name, in children. It is a manifestation of the infection that really hadn't been appreciated. We thought this was a pneumonia respiratory infection. It turns out that in some people, and in this case it's kids, it elicits this sort of inflammatory response. The good news is that at least so far, this seems to be really rare. It's estimated that we've probably had about 170,000 people in Colorado infected with COVID. And this is not something subtle. This is pretty explicit. So the fact that we've only had 3 kids that have been recognized so far, to me, implies this is going to end up being fairly uncommon. But it is important and it is concerning. And certainly those who've got kids or grandkids who develop persistent fever, abdominal pain, a bad rash, red eyes, these are signs of that rare syndrome that ought to prompt medical attention quickly.
Wonderful, thank you. Next, we are going to go to Sandy, a live question. And Sandy's question will go to Melissa Sager with Tri-County Health. Sandy, you're live. Go ahead and ask your question.
Good evening. I know that they're working on trying to get all of our restaurants open. Down here in Inglewood, we have so many wonderful restaurants that are smaller that have been struggling to survive. And now they're saying that they're going to have to put them in the street, put them in the parking lots. Some of these restaurants don't have that capability. What are we going to be able to do with all of these smaller restaurants that, everybody loves, and they've been hanging on by their teeth?
Andy, thank you for that question. Tri-County is working with a number of local governments in Arapahoe County on this issue specifically. Your local governments are looking into and changing policies regarding the serving of food in outdoor spaces, as well as the serving of alcohol in outdoor spaces. They're looking at zoning requirements, and they are looking at what you described, but it may look like the restaurant operates just outside of their restaurant on the sidewalk space, and maybe the street is closed on the weekends so that pedestrians can walk the street to get to those restaurants. That allows the restaurants to stay connected, expand their area out onto the sidewalk to accommodate more seating. And so your local governments are looking into what needs to be done to make these accommodations, and Tri-County Health is partnering with them to make sure that that's happening safely. It still does look a bit different than we're used to. We anticipate reservation-only dining, again, to control the number of folks coming and going, and some measures may be requiring masks in those common spaces and hand sanitizer along the sidewalk. So it looks a bit different, but we are looking into getting these businesses open because we know how important they are to the community.
Thank you, Melissa. Now let's go to our poll question, number 2. People are understandably anxious to get back to regular activities, and we'd like to know what you're most excited about to do as these restrictions are eased in the coming weeks and months. So what are you most excited about? Press 1 to travel within Colorado. Press 2 to travel out of state or out of the country. Press 3 if it's to visit your favorite restaurant. Press 4 if it's to get back to the gym. Press 5, going to a sporting event. Or press 6, just taking your kids to a playground. Again, that's 1, travel within Colorado, 2, travel out of state, 3, visit your favorite restaurant, 4, get back to the gym, 5, sporting event, or 6, take your kids to the playground. Thank you so much. I see all of those votes coming in. Okay, let's go to our next live question. This question is for Selena, and Alan is live. Alan, go ahead and ask Selena your question.
Nobody in the stands, and they're cutting the distance of the Belmont Stakes down from 1.5 miles to 1.1 miles. So it's not
Alan,
going to be.
Are you there?
Yes.
Hi, Alan. Go ahead and ask your question.
All right. This is related to one earlier. I've been driving on temporary tags on my car that outdated at the end of March. I'm going to be subject to a fine or citation if I'm seen driving with outdated tags. And how do we go about getting new ones with the DMV closed?
Hi, Alan. This is Selena. So you have a couple avenues. First, I want to let you know that the state and soon the county, we're reaching out to law enforcement. I'm asking them to be lenient on outdated temporary tags as well as expired registrations because in some cases there have been delays in people being able to actually procure physical license plates and get their registration renewed. So I wouldn't worry about it too much, but I would definitely go on our website. Just so you know, we're pretty caught up on all our mail-in work. So if you have temporary tags, first thing you'd probably want to do is to email us at clerk@arapahogov.com. Just put your name, and if you have your VIN number, it would be helpful to put that as well. We can research your account and reach out to you via phone or email and let you know when you can make an appointment to come in and get license plates. We've also been granted temporarily the ability to take payment via phone by credit card for credit cards, and then we could mail the plates out to you. So you'd have a couple different ways in getting that completed for yourself.
Great, thank you. And Sheriff Brown, could you weigh in on that as far as your side of things?
I sure can, Erica. Thank you for including me on that. I was going to push my way in if you didn't let me. We are slowing down. We're not enforcing that as much. Obviously, if there's other violations, like speeding, we had speeders on Parker Road the other day that were doing 105 miles an hour, and then another speeder on Arapahoe that was doing 88 in a 55 mile an hour zone. So if there are instances like that, but we are not enforcing that as the sole violation. So rest assured, sir, that if that's the only thing happening, we understand that we've been closed down as a county government, and you haven't been able to get those plates. So we are making sure that our deputies are aware of that. I've talked with all of them, and that there is a positive intent there for you to get those plates as soon as you possibly can. So we are slowing down the enforcement of that.
Wonderful. Thank you so much, Sheriff. Now let's go to our next live question. This is Jerry, and he has a question for Dr. Douglas. Jerry, you are live. Go ahead and ask your question.
Thank you for taking my question. I am in the higher risk group, though I am healthy. I have no underlying conditions, but I am 66. I had what I believe was just a bad cold for a few weeks, though the symptoms, that you're supposed to look for seem to change periodically. I never did have a fever. I never had any of the difficulty breathing or any of those things. I wanted to take advantage of possibly the free testing that's out there. I don't currently have a physician right now. Wasn't able to do it when everything kind of shut down. But I was also curious that I feel good now, but if that same testing would provide evidence of the previous exposure to where I could then volunteer to give plasma, but then I'm hearing, so this is kind of a multi-part question, I'm hearing that Tri-County is offering up names and addresses of people who test positive into the area 911 databases. This to me seems very chilling if that is indeed happening. I also heard that Arapahoe County opted out of that, and if they did, I appreciate it. But that seems like a very chilling way for those of us who didn't have severe symptoms to get tested and see if there are ways that we can help. I'm not inclined to want to do that if my name and address is being fed into a database and somebody's going to put a big red C on my front door. Doesn't seem to be a concerted effort in taking care of the 99% most vulnerable. My spouse works in a long-term care facility. I actually help to provide some face masks and such to them through a vendor I knew. There doesn't seem to be a lot of attention towards the people who really need the help with this virus.
Dr. Douglas, can you go ahead and answer his question? Thank you.
Sure. Yeah, you've raised a lot of important points there. Let me cut to the chase on one of the points. Perhaps the most concerning one is your comment about whether or not Tri-County is sharing information about people who test positive. For law enforcement agencies who are interested in knowing the addresses of people who are actively infected, that is, those who, if law enforcement were to be called to that address, there could be some risk if they weren't using full PPE, which, as you already alluded to, is in short supply, not only in nursing homes, but for our first responders as well. We have shared that address information. The address information is shared without any other identifying information, certainly not the name. It's done only for those with active infection, and the information is removed from the computer-assisted dispatch system after 14 days, the average duration of infection. For someone who is interested in getting an antibody test, which was the scenario you were describing, and there are places that are offering that, including in Arapahoe County, that is not considered a sign of active infection, and that would absolutely not be something that would be shared. I do want to offer a note of caution around the antibody test. I think there's a lot of potential value. Frankly, I was sick 2 months ago, and I've wondered, gee, could I have had it? The performance characteristics of the test are still being assessed. A positive test probably really means you had it. We don't know if it means that you're immune. There are laboratories at Children's Hospital that are looking for plasma donors, and they might be able to help you if you had a positive test, figure out where you stood. A negative test does not mean you didn't have it, because the test performance characteristics are not always such that once you're infected, you have a positive test. So I hope I got to the points that you were concerned about.
Wonderful, thank you. Now let's go to our next live caller, and this is for Melissa Sager with Tri-County Health. This is Dan from Centennial. Dan, go ahead.
Hi, thanks for taking my call. My question was, what are the plans for reopening the public libraries?
It's a great question. Currently, libraries in Arapahoe County are allowed to operate through curbside pickup, and so reserving those materials online, picking them up at the library, they'll bring them out to your vehicle, that kind of situation. Libraries pose a little bit of a riskier situation because people move around within a library. They use shared equipment like computers or tabletops. They may be closer to each other than we would like. And so we are talking to libraries. We're talking to the state about what it can look like to have in-person activities resume at libraries. And so we do expect guidance in the future and are actively having those conversations.
Great, thank you, Melissa. Our next question is an online question. This is from Don, and he wants to know, what are you doing to keep voters safe in the upcoming elections? And if you can answer this, Peg Pearl, since you're the elections director, go ahead.
Great. Thanks for that question. Yeah, we are looking forward to the June primary here on June 30th for the state election. And already here in Arapahoe County, 98% of our voters return their mail ballots as the way that they vote. So we're building on that foundation to help you stay healthy and hope you can still vote from home and use our process. So right now, you can update your registration if you've moved online at govotecolorado.com to make sure that that mail ballot will get to you when we send them out in early June. And then you can return that ballot by mail or at one of our 24-hour drop boxes. We have 29 of them around the county. And in fact, we're even going to be opening a new one in Aurora in time for this election. And if for some reason you do need some extra services, we are holding appointments right now that you can book on our website to come in and work with one of our voter services employees with our precautions to be able to deal with you one-on-one and any needs that you have for your ballot or for your voter file and registration. And we're also looking to roll out a way that you can get curbside pickup of replacement ballots. So that you can, again, call our office and find a way at time that's safe for you to come and pull up to one of our vote centers and have a ballot brought out to you in your car so that then you can stay safe while you are voting your ballot. And if you do come into one of our vote centers, our election judges are being protected with masks and hand sanitizer, and we'll have all those supplies for our voters as well if you need those services.
Great, thank you so much, Peg. And our next question is for Melissa Sager. It's a live question. Jana in Aurora. Jana, go ahead and ask your question live.
Yes, hi, my name is Jana Black, and I was just wondering when we can start going to church. I know my pastor said that we can't have more than 10, but he offers 2 services so that we don't get overly loaded down. And I just wondered when that would be a possibility.
Thanks for the question, Jana. We have been talking to our churches a lot lately, and we are looking toward what it looks like to have more folks in the church at one time past that 10-person limit. Currently, that 10-person limit is the recommendation for our places of worship. We're looking to keep those groups very small. But as we move into the next phase of reopening, churches are coming up with very unique and innovative ways to keep their congregants safe when they come to worship. They're doing a variety of things, which means that we may be able to put more people into one space, but that it's going to look a bit different from what you're used to. It's still going to be smaller groups than we could fit into a church usually. It's going to look like folks wearing their mask. Maybe as they come to and from church, maybe they remove it while they're sitting still and 6 feet away from everyone. But as we move about having that mask on, we're still asking vulnerable folks to stay at home because it's risky to be around those larger groups. And because of that, we're really asking our churches to still pursue these innovative ways of connecting folks to their place of worship remotely. So we've seen churches live stream those events and innovative drive-in services. And so it's going to still look different, but we do anticipate there being slightly larger groups allowed in the near future.
Wonderful, thank you. Okay, next we have a question for Dr. Douglas. We have Sheba, and she is live. Go ahead, Sheba.
Good evening, thank you. My question is concerning the stay at home, which I am doing, but can I go visit a friend? And also the opening of the nail shops and the salons, hair salons, and also about having repair people come into my home to do repairs. What is the guideline on all of those questions?
So this is a bunch of... I'm sorry, am I on now?
Yes, Dr. Douglas, go ahead.
Okay, thanks. Sheila, good questions. Staying at home, I think, can you visit a friend or have a friend in your home? I'd say that in general, that depends upon your personal health situation. Those of us that are over 65 or have underlying illnesses, diabetes, heart disease, lung disease, ought to be a little more careful. The governor's been saying act in May like you were in April, which is to sort of try to stay a little sequestered. I would say that if you're not in those groups, I think it'd be fine for you to visit a friend, practicing some of the social distancing guidelines we talked about face coverings, social distancing, restrain yourself from giving your friend a hug, do hand washing. If you are in one of those higher risk groups and you would like to get together, and frankly, I've got family who asked me that question, I think it would be reasonable to cautiously do so in an outdoor setting. We do believe that being outdoors provides ventilation that will reduce transmission. Nail and hair salons are personal services that are now open. They have constraints about them in terms of how many people can be in the shop at one time. And both the employees as well as those who are seeking services are asked to wear masks, face coverings if possible. That's easier in a nail salon than in a hair salon, but they can be open under those circumstances. And then finally, I would say home repair, sort of same guideline. If you are in a vulnerable group and you've got somebody coming to your home, ideally you'd like them wearing a face covering, and you'd like to be out of the vicinity, like to be distancing yourself from them in another room if possible. But it is, if you've got a repair that needs to be done, it's quite reasonable to have somebody do it as long as you take those precautions.
Wonderful, thank you. Next we have our live caller. This is Josh, and Josh has a question for Melissa Sager. Josh, go ahead and ask your question.
Thanks. A lot of great questions, a lot of great answers. I really appreciate the one on antigen testing. But my question is pretty simple. For recreational, following up on some of the sports that's been talked about, is when will the tennis courts be unlocked so people can now play on them, since they're allowing golf sports potentially? Thank you.
Yeah, that's a really great question. So under the current Safer at Home order, tennis courts can be open. It's recommended for single play or members of the same family. It's going to depend on the park that you're using. So in some situations, a tennis court may get crowded in your neighborhood. It may be the place that a lot of people like to visit, and there could be lines and folks waiting to use the court. And in that case, they may keep those closed. Or alternatively, we've seen parks open just one court so that it's not too many people gathered and only one court can be open. They are allowed to be open. Again, it's going to depend. And we anticipate updated guidance on a variety of different outdoor activities coming with the latest update from the state next week. And so I'd keep an eye out for anything to change on that. But for tennis, we're worried about shared equipment, the ball that you're hitting back and forth that you may touch, and we're looking at any close contact that could happen as you engage in those activities. So keep an eye out for that updated guidance, and look to your park, your individual park, as far as which tennis courts are open.
Perfect, thank you. Our next caller is Chantel, and she has a question for Dr. Douglas. Chantel, you are live. Go ahead and ask your question.
Hello, Dr. Douglas. I have a 6-year-old granddaughter, and I have continued practice social distancing, and her mother has also been continuously practicing social distancing, but we have a play date to bake over at my house on the 23rd. Part of the reason why we made this play date is because we are seeing that the numbers are dropping in the city of Aurora. And my question is should we be using masks and gloves when we get together on Saturday?
Chantel, thanks for that question. I'm delighted you're having a play date with your granddaughter. Congratulations. It sounds like your granddaughter has been, like you, kind of careful. At least her mom has been careful. She's not been around too many other people. I'd say that if you're going to be quite close together, leaning over, cutting cookies out of a pan or something like that, and she's willing to wear a mask during that close encounter, that's probably a little extra insurance. But honestly, not every 6-year-old, my grandkids won't wear masks unless I crack the whip, and it's maybe hard to get her to do that. I wouldn't not get together with her if that's not a possibility. I would, avoid hugging her, even though you, I'm sure, really want to, because of the 6-foot kind of rule of thumb. I would keep the windows open. I would use good hand washing, but I would not be worried if the masking couldn't work about being in her presence, and I would enjoy that, what sounds like a fantastic date.
Perfect, thank you. And the next question is also for you, Dr. Douglas. We have Annette in Aurora. Annette, you're live. Go ahead and ask your question.
Thank you for taking my call. I have a quick question. I need to take a round trip by car from Aurora to Little Rock, Arkansas, and I was wondering if there are any specific requirements upon leaving Colorado and returning to Colorado in terms of quarantine, like that.
There really aren't, in a nutshell, in that. You want to be careful on the route and take the kind of precautions we've been talking about as you drive, and gas up and stay in hotels along the way or wherever you'll be staying. The only caveat, Little Rock is not a particular hot spot. And frankly, even the hottest spots in the country right now, Washington, Chicago, LA, we're not recommending that if someone travels and comes back, they need to quarantine. The only exception would be if whomever you're visiting in Arkansas were to be sick or to be known to have COVID, then we would make the recommendation to you, like we would anybody else when you get back, is to observe a 14-day quarantine period, and if you get sick, to seek testing yourself.
Great, thank you. And our next question is for Peg Pearl, our elections director. We have Joe on the line. Joe, you're live. Go ahead and ask your question.
Yes, I gather that there be a voting booth available for those who don't mail in ballots.
Joe, Yes, Joe, thanks for your question. Our Colorado model will still continue, where there will be 6 different places in the county where we will have voting booths and accessible voting as needed for folks. If one of the other options that I laid out earlier don't work for you, those will be open for 8 days before Election Day. So we also urge folks to keep a lookout for those other days that you can come in before June 30th, including on Saturday, June 27th, to be able to come in at a time where it's not so crowded and be able to observe social distancing even easier. If you do have certain needs that require you to come in person, absolutely, it'll be available in that way.
Wonderful, thank you. And we have time this evening for one more question, and this will be for Dr. Douglas. And we have John on the line. John, you're live. Go ahead and ask your question.
Good evening. My question is, since there is no vaccine for any coronavirus in existence today, there's no guarantee that there will be a vaccine. And since it's essential and critical to get the economy going, that shouldn't be in the critical path.
Dr. Douglas, are you there?
Yeah, I'm sorry. I didn't know if John had finished his question. We don't have a vaccine for coronaviruses, John. You're right. So we're embarking, and even if we did, this is a novel one, so we're on terra incognita. I would say that, frankly, the early returns look pretty promising, but you can't bank on that. And so you're absolutely right. We're not talking about, or can't really talk about a circumstance to having a vaccine before we revive our economy. There are just far too many social, economic, and health downsides to that. So we would, if we don't get a vaccine, then we will be doing the best we can to have an economy that's as open as possible while we protect ourselves and prevent the situation where hospitals might not be able to care for everybody. So fingers crossed we get a vaccine, but you're absolutely right. The economy can't wait on that.
Thank you, Dr. Douglas. And we have enjoyed this time with you tonight, and we hope that you have found it useful. Before we leave, we'd like to bring 2 more of our county commissioners back on the line to wrap things up for us. So first we have Commissioner Bill Hohen. Go ahead, Bill. Bill, are you there? You on the line?
Thank you very much. I just want to thank Dr. Douglas and the Tri-County Health for their time and expertise in providing the necessary information for our constituents. This is a very difficult time for all of us, both economically and from a governance standpoint. The county commissioners have been committed to provide services to all our constituents, as well as maintaining the governance requirements through telecommunications and the internet to make sure that all our functions are provided efficiently and effectively. I just want to thank the patience of our constituents and please urge them to be able to ensure that they follow the guidelines set forth by Dr. Douglas and the governor in ensuring that we can put an end to this pandemic. Thank you.
Great, and now let's hear from Commissioner Kathleen Conti. Kathleen, are you there? All right, I'm not sure Kathleen is on the line, but I do want to thank
I'm on
everyone.
the line. I apologize. I apologize. I am
Go
on
ahead,
the line.
Kathleen.
Yes. Okay. I just want to thank everyone for tuning in tonight. So sorry, my phone was muted. And the other commissioners and I are confident that we can get through this crisis by continuing to work together. And we welcome your suggestions and questions for how we can best implement all of these changes. So thank you for tuning in, and I hope you get out and enjoy the beautiful Colorado skies and evening, and it was beautiful out tonight.
Wonderful. Thank you, Kathleen. And thank you all commissioners, and thank you everyone on this call for joining us tonight. Be well, and as a reminder, we'll post a copy of this recording to our website in the next 24 hours. Have a great evening.